You have the ability to request eligibility information for a group of patients based on an appointment date range, or for a single patient for a particular service date range. In this video, we will cover requesting eligibility information for a group of patients based on an appointment date range. To do this, click the Payer Inquiries tab, then click the Eligibility tab, and then the Appointment List sub-tab. Next, in the View Appointments From and Through fields, enter the applicable date range for the appointments you want to select, and then you can select a Sort By option. It is recommended that you sort by insurance to save time when selecting patients, since only certain insurance companies provide eligibility information, and patients with those insurances are the ones you want to select. Check the patients that you want to include in the eligibility request from the list below. You do have the ability to click the Select All button to select all of the patients listed. However, this is not recommended, since if you have a large amount of patients, this will significantly slow down the server and will affect your coworkers. Likewise, you only want to select those patients with insurances that provide eligibility information. Also note that you are able to modify the insurance for patients if needed. After the applicable patients have been selected, click the Request tab. In the Request area, the Submit for Accounts selected on Appointment List tab should default checked, and the number of patients selected should follow. If this option is not selected, click it now. Enter or search for the requesting provider. The qualifier, type, and taxonomy will default from the provider screen if these items were configured. You can add and modify the information in these fields as needed. The requesting provider and qualifier are required. Next, in the Request Type field, select the applicable request type. Typically, this is 472 service. And then in the Service From field, enter the start date for the eligibility request. Typically, the Service From date is the only date that is needed, and the Through date is not needed except for when requesting information for a hospital visit that spans a specific date range. Now, in the Eligibility Benefit Service Type field, select the service type. Typically, this is 30 or 98. The Request Type, Service From, and Eligibility Benefit Service Type fields are required. Do note, if you click the Retain Service Information option, the system will automatically save the information configured in these three fields until you log out of Practice Manager. Once all of the information is configured as desired, click the Submit Request button. Your request will now be transferred, and you will be taken to the Submitted List tab. In the Submitted List, you will see your submitted requests. The eligibility replies are color-coded to assist you when viewing. A submitted eligibility will remain green until a response is received. A red reply indicates that the submission was rejected because something was missing or incorrect in the eligibility submission. A black reply indicates a successful transaction, but does not necessarily mean that the patient is eligible. To view the eligibility reply, click the Refresh button until the green request turns black or red, and then highlight the appropriate eligibility reply, and then click the View Reply button.